Well, snow-capped hills from the blizzard of 2012 could be contributing to an increase in emergency room visits. More snow means more opportunities to enjoy the outdoors, of course. News 3's Margot Span has some tips from the experts to keep you and your family safe while sledding. Margot?
That's right, Eric. The doctor we spoke with said nationwide thousands of people are seriously injured while sledding every year, and he says that most of those injuries happen at the end of the run, especially if it leads into a road, a parking lot, or some trees. Lisa Mortensen cautiously watches her daughter, 7-year-old Christina, make her way up the hill at Elver Park.
She stays midway on the hill, and she just kind of keeps an eye out for the other kids, and she doesn't go really fast either.
It's not the speed on the hill that has St. Mary's emergency room physician, Dr. Michael Halberg, concerned.
The truth is that sledding, you're actually more likely to get a head injury than when you're biking.
Dr. Halberg has seen about a 25% increase in snow-related emergency room visits this year. To avoid injuries, he recommends children under 14 years old wear a bike helmet.
The younger kids actually are at higher risk for head injury related events. What we recommend is anyone under the age of 5 just be sledding with a parent. So they should be on a 2-person sled.
We just come out when it's not so busy during non-busy times and stuff like that, and then I ride with them a couple of times.
More than half of the emergency room visits are head injuries, something Dr. Halberg says are mostly preventable. Though we didn't see any helmets, some agree with the idea of kids putting on a bike helmet before hitting the hills.
If there were more of a crowd here, it might be an issue, and especially when you're coming down and people are still recovering from their first ride. But there aren't that many people here today, so I'm not worried about that.
He actually has one. We forgot it today, but we typically do.
When we go ice skating, she wears a bike helmet, so I would do it for sledding as well.
Now, the doctor also recommends staying off the slopes at night, just because if there are any hazards that are lurking at the end of the run, it'll be a little bit tougher to see them at night.
And bundle up, I suppose, too.
Absolutely.
All right, thanks, Margot.